Semi-Medical University, Psychiatry Department, Communication Skills Discipline. Topic of the video lecture, Informing and Planning. Patients often do not understand or remember information from the doctor. 27.9% were able to name all prescribed medications. 37.2% were able to tell the purpose of prescribed medications. 40% were able to list side effects, and 41.9% were able to give their diagnosis. The patient has the right to make any informed decisions about their health. To ensure independence and freedom of choice, the patient must be provided with all necessary information about their health, planned examination, treatment, and guaranteed social rights. It is also necessary to inform about the safety of the use of medicines. The doctor is obliged to formulate prescriptions with all the necessary clarity to ensure that they are understandable to the patient and his environment, and to exert perseverance to ensure that they correctly perform the prescribed. The doctor must provide the person who is being examined, treated, or given advice honest, clear, and relevant information about their condition and the research and treatment they are being offered. Inform the patient's health status in language accessible to the patient. Discuss diagnosis, causes, course of events, prognosis, and complications. Avoid scientific and medical terms. In planning, consider the patient's point of view. Use the two-way discussion of the next action plan. Ask for the patient's opinion and consent. Providing information in a form that makes it easier for the patient to understand and remember it. Information should be divided into logical sections to improve memory. Clear and unambiguous information without medical terms or explanations in clear language. Clear categorization or setting benchmarks. For example, I would like to discuss 3 important points. First, visual methods of transmitting information, illustrations, models, written instructions, repetition and summarizing, active verification of what the patient understood. For example, ask the patient to repeat in their own words. Timely information provided must be clear, understandable, and provided in simple language. So the patient should be properly informed about the goals, methods, expected benefits, and if necessary, the possible risks of the examination. For example, doctor, the treatment that we recommend is removal of the gallbladder patients. So, doctor, now this operation is laparoscopic. Patient, yes, good. Doctor, do you know what is this? Patient, well, I've heard something about laparoscopy, but I don't know anything specific. Doctor, you will need anesthesia, and while you are sleeping, we'll make 4 tiny holes in your stomach. Fill you with the carbon dioxide, and we can see where the gallbladder is. And then, with the laparoscopic, we'll cut off the gallbladder along with the gallstones. Patient, okay, I understood. Doctor, we'll put the gallbladder and the stones in a small bag and pull them out through the holes. The biggest hole is quite small, about 1.5 centimeters, and the other 3 are less than 5 millimeters in diameter. Patients, okay, it's clear. Planning, making a cooperative decision. Check whether the patient wants to participate in planning. Second, exchange ideas, opinions about what is being discussed, in particular any problems or obstacles that is foresees. Third, offer options, not directives. And fourth, agree on a plan acceptable to both parties. 5. Provide information about the various options, pros and cons of each. Encourage the patient to make choice and make decisions. 6. Check that the patient agrees with the plans and that all concerns have been addressed. Thank you for your attention.